He and his employees took precautions such as wearing masks and physically distancing. But visiting clients' homes daily meant a high risk of exposure to the coronavirus. It was just like dodging bullets every week, Warner says. In June 2020, an employee tested positive. That sent Warner and his wife on their own hunt for a test. Because of limited testing availability at the time, they drove 30 minutes from their home in Dallas to a freestanding emergency room in Lewisville, Texas. They received PCR diagnostic tests for the coronavirus, as well as rapid antigen tests. When all their results came back negative, it was a huge relief, Warner says. He eagerly got back to work. The patient, Travis Warner, 36, is self-employed and bought his health plan from Molina Healthcare via Healthcare.gov. Medical service, 2 COVID tests for the coronavirus, a diagnostic PCR test, which typically takes a few days to process and is quite accurate, and a rapid antigen test, which is less accurate but produces results in minutes. Total bill, $56,384, including $54,000 for the PCR test and the balance for the antigen test and an ER facility fee. Molina's negotiated rate for both tests and the facility fee totaled $16,915.20, which the insurer paid in full. Service provider, Signature Care Emergency Center in Lewisville, one of more than a dozen freestanding ERs the company owns across Texas. What gives? Throughout the COVID-19 pandemic, stories of shockingly high prices for coronavirus tests have abounded. A recent report from an insurance trade association notes that price gouging by certain providers continues to be a widespread problem. Warner's PCR bill of $54,000 was astronomical and egregious, according to health policy researchers we talked to. Yet it's perfectly legal. For coronavirus tests, like much else in American healthcare, there is no cap to what providers can charge, says Lauren Adler, Associate Director of the USC Brookings Schaefer Initiative for Health Policy. Testing for the coronavirus has been in a special category, however. When the pandemic hit, lawmakers worried that people might avoid necessary testing for fear of the cost.